So I was introduced to Coro Health. I want to say it was probably 2019, I think, 2019, 2018, I think, when we started to, because it was pre-COVID, I think, when we first started to make great connections. So it's been a couple years. And a few of my colleagues, I work for Hartford Healthcare at Hartford Hospital, and me and a couple of my colleagues wanted to do something for our patients to help reduce anxiety, help them sleep better. And we work in a cardiac unit, in the cardiac step-down ICU, and realize the level of care, so how sick they are. So in the ICU, they're the sickest of the sick, and the step-down is just a little bit less sick, but they're not like on the floor where they can like be monitored. They're monitored more closely in these two units. So we get a lot of patients with heart failure, waiting for heart transplant, heart attacks are kind of our main patient population. And so with that, we were noticing a lot of our patients obviously come in with anxiety, lots of fears, get delirious at night. They're there for a long time, lots of things. And we were trying to think of something that could benefit our patients as well as our staff, but not be a burden and not take up more staff time or, patient care away. And so we looked into it, and I had done some preliminary research on music therapy. So we were connected to the new program that Coro Health had the capability of being on our TVs on the patient rooms, but we didn't have that. So it wasn't like accessible yet. So one of the colleagues got a grant for patient satisfaction, and we used that money to get the wiring done so that way the TVs could actually be updated and have the capability of playing the Coro Health music program. And then from there, we reached out to Coro Health to talk about their services and what they offer and how we can customize it for our patients there. We got the funding to improve patient satisfaction, so we used it to get the TVs and get the music therapy up and running for them. We were able to wire once COVID kind of alleviated a little bit. So in 2021, I think, is when we finally really were allowed to let people in, non-essential, to upgrade all the wiring in the patient rooms. We got more than one unit. So the ICU is small, so there's only 12 patients in there. And the step-down only has 9. But we were able to expand to other cardiac floors. So not just the ICU got it. We were able to go to another unit called Bliss 10 East, 10 North, and 10 South, and Center 10. So we were able to kind of expand, and we also got some of the 9th floor for the cardiac surgery patients. So we were actually able to expand to quite a few units. And actually, we are still in the process of revisiting that grant. So I was working on this pre-maternity leave to get the rest of the money and to expand to further units. So we are still trying to work on it slowly and trying to expand the capability to everyone. It's kind of like a thesis, but you implement. So you implement the change. And so I had done some preliminary research that music does help reduce anxiety. And so we tested it and we implemented the music first. What I really liked about this program in particular, compared to other programs, so compared to just playing YouTube, Spotify playlists, or Pandora's or anything like that, is music has been shown to have a prescriptive effect on patients or people in general. So for example, when you go to the gym and you're playing loud, exciting, dancing music, it gets you up and moving. If you're trying to go to bed, you might play something softer and classical, and it helps enhance mood and enhance how we feel. And there's reasons for that. And so what I really liked about Coro Health's MusicFirst is that they used music therapists to get that effect. So they keep in mind the tempo and the vibrations and the hertz and all these things that are beyond me, because I'm not a music therapist, curated for an effect. So to really help us get us from A to B without commercial interruption. So I didn't need to pay a subscription to Spotify. And what I really liked about it too is it gave the patients options. So they didn't have to just listen to classical if that wasn't their mood. If they wanted something more lively, some of them, are more Woodstock and they want their rock and roll and they want some of them are more country. So they were able to kind of pick what they wanted, which I think really helps reduce the anxiety if you're not being forced to listen to something you really don't want to be listening to. We found that the most popular choice, because we polled it, what people chose, and rock and roll was 26% of patients did choose rock and roll, and then actually 22% did choose classical music. And 17 did country. Yeah, I thought smooth jazz would be popular. Most of our patients, and that's what you also have to look at, is what your patient population is, are in their like 60s to 80s. I think it was kind of 50s to 80s is our range. And so I was really thinking that it was going to be like smooth jazz or like oldies, maybe some spiritual in there, but I was really surprised. So rock and roll was 26 and then followed by classical. I thought that using music therapy has quite a place in acute care. So it's very challenging in a hospital setting, especially when the patients are so sick, to really bring in complementary therapies or holistic approaches. And they're hard because the focus is on other stuff. They're really sick. So to find time for staff to implement other things, resources to implement those things can be really challenging. And as COVID showed us, infection also. So it's not something that we can just have and share amongst everybody. So it was trying to find how can we bring them comfort with keeping in mind all of these things, with keeping in mind that we have a lot of staff that are in and out, a lot of families that are in and out. So we need source and infection control. We need easeability or feasibility of it. We need it to be easy, accessible, and not so time consuming for them. And music really fits that, because if you can just pick a playlist of their liking that is curated to get you to what you need, whether it be to reduce the anxiety or to help the delirium or insomnia, it will alleviate a lot of other things for staff, for patients, and not take up so much time. And it didn't require a lot of infection control. We didn't need to, having it on the TVs allowed it to not be, we didn't have to sanitize iPads and make sure that they were, being brought in from one patient's room to another and being cleaned during COVID. We didn't have to figure out how to get the headphones clean and from one room to the other, or stolen, or if someone was using it and somebody else wanted to be using it, we didn't have to worry about like funding 20 of them that might be disappearing, things like that. So having it right out of the speakers of the TV, the patient could turn it on when they wanted. So it allowed some control of an environment that they have no control over. And it allowed for infection control as well during COVID. So they could just turn it on and we didn't have to clean everything. So it was met with great acceptance. So a lot of people were very excited about it. They thought it was a great idea. They thought it was really cool that we were getting it on the TVs and that they didn't have to fuss around with speakers and headphones and like iPods and things like that. And they could like just show the patient how to turn the TV on and click, and there it was. So a lot of the nursing staff was very excited about that. A lot of the patients were also, once we like played it for them or told them that it was there, they didn't have to watch Maury or Jerry Springer all day. They could like listen to something else that they could control. So in a lot of upper management actually was very excited about it too. So they were looking forward to the results and the implementation of the project. The process of implementing is, so while everybody's excited about things, the reality about implementing change is always a different challenge. And the biggest challenge is actually the continuation of implementation. So implementing in the beginning is one challenge, and then continuing the project and ongoing is a whole different challenge. Unfortunately, with it being COVID, when we were implementing and kind of towards the end of COVID, the tail end of it, there was a lot of caregiver burnout and a lot of caregiver turnover. So implementing was a challenge. In this situation, I don't think had anything to necessarily do with the project itself, but more of what healthcare was going through, because every time we would onboard or educate any staff on this, within a couple months they were gone, and I'd either quit or moved on to different jobs. And so it got to the point where it was just so many new people all the time that it was really hard to keep re-educating. So now I'm working with one of the nurse educators currently on two of them on trying to figure out a more sustainable and long-term solution to educating the staff on this. So it is being added to part of their regular nurse onboarding. So all the nurses get brand new nurses get a checklist of like, these are all the things you're going to learn while you're here, and how to do and talk about, and it's being added to their program to know about it. So we definitely changed directions once we started seeing that we were just re-educating too frequently. We had done some webinars, but to continuously do webinars all the time and get the nurses to attend, because they're all different schedules and some shifts are busier than others, it was getting really challenging. So we kind of decided that the onboarding and the nurse educators, getting the nurse educators invested in the program, which was easy to do because they were very excited about it and they really liked the program. So they were more than willing to talk with me, work on some educational material, and approve it being placed in the onboarding. So now the next challenge is to see if it's actually being taught. I actually had one patient who was a musician, and he teaches music to kids. And I won't forget how excited he was to find that we had this, and he was very into it. I mean, so I spent a long time with him going through the playlists because he was so excited. He was very into all the genres. And just seeing what the library had, the options that they had, and asking me if, maybe they should put this artist in, and just like so invested into it. He's like, they really got to look into this person. Like, this person would be great for this category. And just, so he was and he wrote me a thank you card, and was very excited that had something for him to keep his mind off of, because I can't recall what he was there for, but I remember he was there for quite a few days. So he was there for a while and getting a little stir crazy. And so he was very excited that it could be there and have something to take his mind off of things, and brought him a lot of joy. So defending your research is always fun. So you do have to, once you do it, implementing it is one thing, then collecting the data. We did anxiety assessments on patients. And so having the staff help with collecting anxiety assessments and getting patients to agree was stuff. So we collected all the data. We didn't get as many patients as we had hoped, again, during post-COVID, so it was kind of challenging, but we didn't do too bad. We got 26 patients that we collected that participated during this time frame, and then I had to defend the research to a board at the university, so made up of advisors and members and whoever wanted to come and present what we did. For my board, it was the first. From what we've learned is not only is the music therapy very individualized, but it's also very different from diagnosis to diagnosis. So what might work a certain way for patients with knee replacements or with dementia might not necessarily work with cardiac patients. So the things you have to look at are going to be a little bit different, because you have to really look at why they're there and what physiologically is going on. And for example, one of the biggest things is a lot of research is out there saying that it helps lower blood pressure or heart rates or things like that. But when you're looking at cardiac patients, a lot of them are on medications that already reduce and control their heart rates and blood pressures. And they might be on quite a lot of it. So it's going to interfere with your results. So you're not going to really see a drop in heart rate or blood pressure as significant, or you shouldn't, as significant as you might see it in something else where they're not necessarily on those meds. Same thing with like when you're doing it with dementia and agitation, they're agitated. So when you're agitated, you're in the fight or flight, your anxiety is up, your heart rate, your blood pressure is up. You might see a bigger effect with calming them down than you would somebody else maybe who's in the cardiac ICU on a bunch of different medications, or vice versa. They're on the medications because they have no blood pressure. So we don't want to lower it. we want it to be higher, and they're on meds to make it higher. So those can confound what you're looking at. So really you are looking at physiological effects, and you have to kind of take each one into what you're studying into consideration. It's kind of what we're working on a little bit. So from my understanding, your question is if another nurse wanted to implement it on their unit and get this kind of up and running, how would they go about it? And so that's kind of what we're trying to do. We're trying to expand it and see if there's any still funding left that we can help expand it. But in terms of funding, it always comes down to funding, unfortunately, with any project and resources. So you have to see what the hospital has to offer. And you have to, so one of the biggest advice I could give is really you have to try to sell it to the stakeholders. My advice is it might sound like an uphill battle at first to get the program, but in the long run, it really does save you. It does save nursing time because it allows for them to have the patient have their own coping mechanism, their own comfort, learn their own skills. that they can translate when they get out of the hospital or not. It allows the nurse to have autonomy to make decisions about the care that they're providing for the patient. So they don't have to always go to the doctor and be like, they're anxious or they can't sleep and they need these meds. And it allows a nurse something to do, something in their toolbox that they can do before they have to get there and before they have to go and ask for these meds and change things and alter the patient and stuff like that. So it does take time to kind of get the program up and running. And there's definitely funding if you can't find it necessarily through like certain grants, that usually there's little grants or donations that come from the hospital sometimes or from like benefactors or whatever that can kind of help with those things. It's just a matter of looking. So having a lot of patience to like look for them, but once you find it, it will benefit you for a very long time, you and the family and the patient. Well, one of the things, because I did so sometimes I would get feedback from the patients about the music selections. So some of them who were there for a little bit of time would like another playlist. So let's say they did pick country or something like that, and they'd listen to that playlist a couple times because they had been there for whatever, a few weeks or something like that. They wish there was like another one, so they weren't listening to the same one. Some felt so different. It was interesting to hear the different music options that people were asking. Some didn't want the singing of like songs that they recognized. They actually just wanted the instrumental background because they were like the singing distracted them and took away from it, from trying to relax, as opposed to, but depending what you're using it for. Some were using it for physical therapy and they liked the words because they would get up and sing it, the songs. So curating it to what, again, more prescriptive to what you're really trying to achieve. So I did get some feedback that a couple of them were like, I wish it didn't have the words to the songs, and really expressing the importance of it having a start and stop time, like not keeping it on all night. That was another educational point that I had to do with the staff a lot, is they would turn it on at night and just leave it on all night. Like, they need to sleep. Like, the point of it is to get them to sleep, and then you turn it off, because if not, you're going to keep re-stimulating every time it starts over, or the sounds change from high to low, and then you're going to start all over again. So it's an evolving, fun project.